Namaste. Welcome to the Healthy Joint Club videos. I am Dr.N.Somasekhar Reddy, Consultant Orthopaedic Surgeon. In this talk, I will present the common causes of joint pains, symptoms and their management. I will also try to clear some misconceptions about the joint pains and their treatment. There are many reasons for getting joint pains. The commonest cause is gradual wear and tear as we age. This varies among the families. Since all the joints in our body would be in different stages of wear, we may get symptoms from one or the other joint at different times. This does not mean that arthritis is spreading all over the body. On the other hand, joint diseases like rheumatoid arthritis or ankylosing spondylitis have specific predilections for certain joints and can affect several joints in the body. When people injure their joints in accidents or even in sports, those joints carry a higher risk of developing arthritis later on. In theory, any joint of our body can be involved. Joints which are more mobile tend to get affected more, and we tend to get more symptoms from weight-bearing joints. The symptoms vary according to the joint involved. Problems with the leg joints lead to difficulty in walking. Same problems in the hands lead to difficulty in reaching and grasping objects, hence affects our day-to-day work. Similar problems in the neck and lower back lead to difficulties with posture and radiating symptoms down the hand or the leg. The common symptom is pain, though this varies a lot between two people. X-rays showing same degree of wear can produce unbearable pain in some people and little or none in others who can manage their activities reasonably well. Contrary to the popular belief, rest is not going to cure the joint pain. Too much rest or too much work both can worsen the pain. Excess fluid may collect in the joint and it may swell up, which restricts some movements. Joint may stiffen up more after a period of rest or sleep. One may hear grinding noises from the joint and also feel as if the joint is slipping. Severe pain in the joints may lead to weakness of the surrounding muscles. Now you may ask me, can we stop joint wear and tear? The simple answer is that we cannot. But with appropriate lifestyle changes, diet, exercises and medication, we can slow it down and reduce the suffering from the same. So what are our treatment aims? Our treatment goals are to have normal working joint with no pain. We should be able to manage our work well and enjoy our little morning strolls or evening walks. The pain should not disturb our sleep, and we should be able to participate in our social activities without the fear of back or the leg pains. There are different stages of joint diseases and we need to tailor the treatment for a given stage. Controlling the weight really slows down the wear and tear and may be more helpful than the drugs we prescribe to slow it down, and the wear and tear can be controlled mainly with the lifestyle changes. Keeping the joints fit with stretching movements and muscle strengthening exercises is very important. Still, one may need to take an occasional tablet for the control of pain. But when it comes to intermediate stages of wear and tear, tablets on and off for pain may become necessary. Pain balms or gels along with fomentations may also help. In addition to drugs to slow down the wear and tear, there are some injections given into the joints, but one should continue with the exercises and joint fitness. Hyaluronate injections given into the joints help reduce some of the symptoms of osteoarthritis for some time. High molecular weight products were shown to work much better than low molecular weight products. They work as lubricants and as shock absorbers. There is also some evidence that they help body produce natural joint fluid and reduce joint pains. Sometimes in these middle stages, especially in the knee joint, patients may experience loose bits, frayed joint cartilage and debris. A keyhole surgery to wash and clean the joint may give good pain relief for a considerable period. Generally, this procedure is done as a daycare surgery, that is, coming to the hospital in the morning and getting the surgery done sometime in the afternoon and going home in the evening after the procedure. When it comes to late or advanced stages of joint wear and tear, patient is in constant discomfort, needing to take tablets for pain relief all the time. Much medication at this stage may be harmful for the body, as many of these patients may also have additional health problems like diabetes, blood pressure and heart ailments. It is important for these patients to be mobile as much as possible to control the diabetes and heart problems. Only solution to get the patient walk well again without pain is a joint replacement surgery. But some people are scared even to think about any surgery. They may have heard about some bad results and also may have had some misconceptions about the surgery. But one should understand that these operations stood the test of time over the last 50 years or more. Rigorous checks are being done at regular intervals by the governmental agencies in the Western countries to make sure that these joint replacement surgeries are safe for the patients. Now, I shall discuss about some myths about the joint replacement surgeries. People might think that the whole joint may be taken away, but that is not true. Only the worn out layer or worn out part of the joint would be replaced. To be precise, when joint's own lining is lost or damaged, new artificial lining is laid down in its place. Here you can see a picture of a normal shiny smooth lining in the first picture, and in the second picture the wear has just begun. The third picture shows completely worn out part of the knee joint where the raw surface of one bone is rubbing on the other bone. The ends of the bone forming the joint are prepared, and a metal lining of the same size and shape will give a new smooth lining in the joint. Between the two metal liners there will be a plastic insert. Sometimes people ask me, "Doctor, what is the right time for surgery?" One would get the best result from the surgery if done at the correct stage, when there is no much deformity of the joint and the muscles around the joint are working well. Patients quickly recover from surgery and would easily regain good range of movement if surgery is done at this stage. But unfortunately, in our country, many a times people leave it quite late due to many reasons. The joints get grossly deformed with some bone loss. The surrounding muscles also get very weak. Hence, the surgery may become slightly difficult for the surgeon and also expensive to the patient, as we may need to use additional material. Patients also take long time to recover and would need long periods of physiotherapy. Another fear of our patients is that if they opt for surgery, they may be a burden on the family, as they may need a long period of help and support by the family members. But that is not true, and on the contrary, people may need constant help if they are relatively immobile due to pain. After the surgery, as they become more independent, they are in fact less burden to the family. People who need assistance even to stand before the surgery can start looking after and caring for themselves. Again, patients are worried that they may have to be on the bed following surgery for long. That is not true. Actually, if the patients are fit before surgery, they may become fit to walk a few hours after the surgery, not days. Another myth is that people cannot climb up and down the stairs. That is not true also. Depending on our own agility and fitness, any time between a week to 4 weeks, patients can start climbing the steps. People who are heavy may take a little longer. Many people think that they are too young or too old for surgery. There is nothing like it. If a young patient is bedridden due to joint pains, he or she cannot be an active member of the family and needs to depend on the family for each and everything. They may not be able to go for work if they earn for living. If they get a pair of pain-free legs, their life transforms. Similarly, irrespective of any age, any mentally and physically fit elderly persons can undergo this surgery and can get immense benefit by rediscovering the luxury of pain-free walking. Some patients have had horror stories about physiotherapy following surgery. Physiotherapy should be supportive and should encourage our own movement and not designed to force a quick recovery. If it is done at a pace tolerated by the patient, it would be a rewarding experience both for the therapist and the patient. Some patients who are very fit before surgery need very little physiotherapy after surgery. A simple instruction is all they need to get back onto the normal routine. We generally advise patients not to squat or sit cross-legged after these replacement surgeries due to the fear of damage to the artificial joint in the long term, which might reduce its life. Gentle strengthening exercises, walking, swimming are always beneficial as they do not cause any quick wear of the joint. So, please keep fit by doing any of these exercises. You can always do a little bit of each exercise. The duration and the frequency is to suit your own capacity that will keep you healthy and happy. I thank you for your attention. If you have any questions, you may post those questions on this website. Thank you.